The cervix, a vital component of the female reproductive system, is a dynamic structure that undergoes continuous changes throughout a woman's life. At the heart of these transformations lies a critical region known as the transformation zone. This video aims to shed light on the significance of the transformation zone in cervical health and its association with cervical squamous carcinoma. Anatomy of the cervix. The cervix serves as the gateway between the uterus and the vagina. It comprises various structural components, including the endocervical canal, external OS, and the crucial transformation zone. This zone is a dynamic area where the epithelial lining undergoes constant modifications, particularly influenced by hormonal changes and age. 2. The dynamic nature of the transformation zone. The cervix undergoes substantial changes during a woman's reproductive years. Puberty triggers the onset of these changes, and they persist throughout a woman's life, culminating in menopause. The transformation zone is a site of continuous cellular turnover and differentiation, driven by hormonal fluctuations, particularly estrogen and progesterone. 3. Cellular changes in the transformation zone. The cervix is covered by two types of epithelial cells, squamous and columnar. The transformation zone is characterized by the transition from columnar epithelium to squamous epithelium. This transition, known as metaplasia, is a normal physiological process occurring in response to hormonal influences. It is precisely within this transition zone that the potential for significant health implications arises. 4. Significance in cervical health. The transformation zone is a crucial area for cervical health assessment. In routine gynecological examinations, healthcare professionals focus on this region to detect any abnormalities or signs of cervical dysplasia. Dysplastic changes in the cells of the transformation zone may be indicative of precancerous lesions, emphasizing the importance of regular cervical screenings, such as Pap smears and HPV testing. The cervical squamous carcinoma and the transformation zone. Cervical squamous carcinoma, a prevalent form of cervical cancer, often originates in the transformation zone. Persistent infection with high-risk strains of human papillomavirus, HPV, is a major risk factor for the development of cervical squamous carcinoma. The virus can cause cellular changes, progressing from low-grade dysplasia to high-grade dysplasia and eventually to invasive carcinoma. Early detection through regular screenings in the transformation zone is key to effective management and prevention of cervical cancer. 6. Prevention and early detection. To safeguard women's health, proactive measures include vaccination against high-risk HPV strains, such as Gardasil and Cervix. Additionally, routine cervical screenings, including Pap smears and HPV testing, play a pivotal role in identifying abnormal cellular changes within the transformation zone at an early stage. Timely intervention and management can prevent the progression to cervical cancer. 7. Conclusion. In conclusion, the transformation zone is a critical landscape in cervical health, representing a dynamic area of cellular turnover and differentiation. Understanding the significance of this zone is paramount for healthcare professionals and women alike. Regular screenings, vaccinations, and awareness can collectively contribute to the prevention and early detection of cervical abnormalities, ultimately reducing the incidence of cervical squamous carcinoma and ensuring the overall reproductive health of women.